All right, good evening, everyone. I'm Dina Darlington, the founder of Links Equity, and I'm so excited and proud to be here this evening with you to talk a little bit more, to continue our dialogue around Alzheimer's and the importance of community as we support individuals living with the disease. Tonight, I think we have a really special addition to our webinar series. We're already at number 5 of 6. And this evening session will be about caring through generations, supporting youth and family caregivers. This has been a topic that has come up repeatedly, and we all know the importance of understanding what our youth feel, how they feel about caregiving and sort of their experience. But we also know how important engaging a younger generation of folks in this dialogue. We recognize that they're supporting their parents, their grandparents, and we also understand that they can introduce technology and a host of other innovative ideas and thoughts and approaches as they support their their grandparents or their parents. So really excited to be a part of this discussion tonight. We're very blessed and lucky and fortunate to have a father-son team that's going to talk about their journey and through caregiving and the work that they're doing now and how that journey catapulted and compelled them to do some really great work. There's a number of various projects they have going on. So I really want to dig deep into our interview with them and so that we can learn more, not only about the great work that they're doing, but I think more importantly is how did this work out from a intergenerational standpoint. Um, Next slide, I will move forward. So before we jump in, I'm going to talk a little bit very quickly about Links Equity, who we are. Links Equity is really committed to supporting community across a number of disease states. Alzheimer's is near and dear to my heart, is that my father was diagnosed with dementia with Lewy bodies, and we had a 9-year journey with him through that process. So this topic is one that I'm super excited to be a part of, and I certainly recognize the importance of community and engaging on this topic. But in addition to engaging community on key disease states, we're a boutique consulting firm that provide consulting services that support access, policy, value to a number of our clients. And our clients include various patient advocacy organizations, but also biopharmaceutical companies as well as we bring awareness and education around key disease states. The Links Equity team is small but mighty. As I mentioned, I'm the founder, Dina Darlington. Our director of strategic operation is Catherine Boxell. And then we also have Joseph Cohen. He's our program consultant for the Alzheimer's community work that we're doing. As I mentioned, this is a 6-part webinar series, and we're on 5 of 6. This webinar series really, the impetus around having this webinar series was to shine a bright light on Alzheimer's disease, but I think more importantly, it was to understand and bring awareness around the fact that by 2030, nearly 40% of Americans living with Alzheimer's disease will be Black or white or Black or Latino. So that's quite a significant jump compared to our white counterparts. So we really wanted to educate Black and Brown communities about this pretty serious stat, but also engage communities so that we understood the resources that's available to us. We had a dialogue around this disease so that we're not to sort of reduce the stigma associated with it and rather focus around the fear of the disease, be more proactive and engaging and identifying solutions and approaches to support folks living with the disease. We also have an amazing community advisory board that supports us throughout this webinar series, and their goal is to really share the information more broadly across a number of communities so that we can expand this great work that we're doing in the webinar series. Our webinar series consists of Reverend James Thurman, Cheryl Tier, Reverend Joseph Owens. He's Pastor Emeritus. Also Rosalind Daniels Walker, Shamika Bacon, Eugene Banks, Gina Haynes Sanders, and Jacqueline Lee. Before we move any further, I'd like to just have a few comments from two of our Community Advisory Board members, and we'll kick that off with Pastor Owens, and then we'll ask Jacqueline Lee to follow behind Pastor Owens. Pastor Owens, can you just share with us a bit about your background from a faith-based perspective, but also why this topic of Alzheimer's in the community is important to you? And sure, I'll ask you to do the same thing after Pastor Owens shares his remarks.
Thank you, Dina. And I certainly want to say thank you to you and Gina for getting us involved. Proud to be a part of the Kentucky delegation here, along with Jacqueline. And my role has been, since I started this venture, I retired after 43 years of pastoring at the Shiloh Baptist Church. But my passion has always been for the greater faith community, as well as community organizing over the past 25 years. So I'm excited to be a part of this. Our people particularly struggle with getting involved, information and inspiration. So my role is to try to touch over 100 churches in this area to be sure that the faith community knows that I have struggles with parishioners as well as family members and friends, trying to marshal them through this. So I wanted to better equip myself so that I could help them to marshal through this situation as it relates to Alzheimer's. So thank you again for letting me be a part of tonight.
Thank you so much, Pastor Owens. We can't tell you how much we appreciate your guidance, your insights, and all that you do to support us on this journey. Jacqueline?
Hi, greetings, everyone. I'm Jacqueline Lee, and I just completed a two-term president as chapter of the Links Incorporated, Frankfurt Lexington chapter of the Links Incorporated, which is a service organization with more than 17,000 members nationwide, 299 local chapters, chapters internationally and nationally. And I am grateful and thankful for you, Dina, and Gina for allowing me to be a part of this fantastic organization. Like Pastor Owen said, it's a thrill and a passion to be able to be a conduit to helping others learn valuable information that sometimes we know culturally are afraid to address, afraid to accept, afraid to look at, and just trying to get the word out. Let our people know, our communities know that this is a service, this is an opportunity for you to learn priceless information, because Alzheimer's affects everyone, whether it's directly or indirectly. You know someone, you see signs, oh, that they're just forgetful, or, some of the taboo, or, they have something else going on. But we need to step up to the plate and face it, that we have family members and friends that really need to have someone, an advocate for them, to learn the different stages where they're at, how to be a caretaker, and just show that real concern rather than pushing it back in the closet to the back. So I'm thankful and I'm grateful to be a part of this mission, and I will continue to do my best to get the word out, to share, to answer questions, to just be there for people, because there's so many people that don't have anyone to talk about difficult or sensitive subjects as Alzheimer's disease with. So I'm hoping that I'm opening myself up to be a safe place, a place of comfort, and to continue to share with my chapter members, friends, and family, to just tap in, find out what you can. If you have any questions, that's good. Let me know. Let's find a comfort space and zone for you. And with that, I'll go ahead and turn it back over to you, Dina.
Thank you so much, Jacqueline. We so appreciate you and all that you do. And I'll, the previous slide really says, we have these community advisory board members, but they go beyond just meeting with us and having a dialogue with us. They're out handing out flyers to barbershops, to beauty salons, at meetings that they're attending across their state. So they're just invaluable, and we're eternally grateful for the work that they do for us. So I'll move into, actually, this was the slide that kind of talked about how they actually, the work that they do, and their work extends well beyond, attending our webinars on a monthly basis, and giving us insight and guidance. They actually do reach into the community, share insights, bring awareness around the actual webinar series, and just serve as a conduit to other folks in the community that can serve and help folks living with Alzheimer's disease. So again, we're extremely thankful and grateful for all the great work that they do. So jump into the agenda. Obviously, we've gone through our welcome and our introduction. Tonight, as I mentioned a little earlier, we're going to have an amazing interview with Dr. Bashir Easter and his son, Jaden Easter. They're going to talk to us about the work that they're doing, but they'll start off really kind of sharing a little bit of insight into their journey as caregivers and what did that look across, how did that look across generations. So I'm really excited to learn more about that, particularly as we talk to Jaden and understand that younger generation and how does this disease impact them, but also sort of the innovation and approaches they use to support their grandparents or parents and living with this disease. Then we'll have a Q&A after the interview. We'll also engage our communities to identify any additional insights, feedbacks that they may have as it pertains to the discussion. We'll have a survey, and typically before we go into the community discussion, I'll share a QR code with you so that you can complete your survey if you'd like before the end of the webinar. But once the interview is completed, that way you don't have to go back to it. So I'll try to get that out ahead of time. We'll also try to put that in our chat as well. And then we'll have closing remarks, and we'll talk a little bit about our final webinar series, or final webinar for this series. We will come back and start a new series, but we try to give everyone a break. We have a very exciting new chapter that I'm excited to introduce all of our participants who's been with us for the past year. But once we start laying the groundwork for that, we'll get information out to all of you about that as well, as we come back to start a new webinar series with new guests, new focuses, and I can tell you this new focus is going to be really exciting. So we're excited to start that. Okay, here's that QR code that I talked a little bit about earlier. If you'd like to go ahead and scan it, this QR code will lead you to our survey, and your information or your feedback is really important to us, and that's why we go through the extra step of sort of trying to have this ahead of time for you. Your insights, your feedback really makes us better. You give us great ideas to think about for our next webinar series. And you ask questions, and we try to get back to each of you with an email or with direct feedback from a professional on a topic that we may not have been able to answer. So we go directly to the source to make sure that we answer your questions. So please take a moment to scan the QR code, and that way you'll have the survey up and ready to go. Okay, now we're going to jump in. Here's the exciting part. We're going to meet our panelists or our speakers this evening. I'm going to just read to you a bio for each of them before we jump into the interview. I think it's great if we get to know a bit about them before we delve into that interview. So we'll start off with Dr. Bashir Easter. Dr. Bashir Easter is a scholar, entrepreneur, and a community leader focused on improving the lives of people of color. He founded Melanin Minded, LLC, and the Melanin Minded Foundation to provide culturally relevant resources that promote equity and community well-being. He holds a PhD in multidisciplinary human services from Capella University, where his research on African American adolescents caring for relatives with dementia highlighted the unique burdens young caregivers face in communities of color. Dr. Easter also led the development of Dementia Villages in Milwaukee, an initiative to create dementia-friendly communities tailored to the needs of individuals of color. Through Melanin Minded, he continues to advocate for inclusive, community-based support systems. So that's a little bit about the senior. Now the Jaden Easter, the son of Dr. Bashir Easter, is a recent high school graduate from Beaumont United High School in Beaumont, Texas. He became a caregiver at a young age for his grandmother, Mrs. Dolores Pitts, who was diagnosed with frontotemporal dementia at age 55. Over 8 years, Jaden gained firsthand experience with the challenges young caregivers face, often without recognition or support. As the Young Adult Outreach Coordinator for Melanin Minded LLC, he leads the Bridge Youth Program, which offers a platform for teen and young adult caregivers to connect, share their stories, and access resources. Through his work, Jaden raises awareness, builds community, and honors his grandmother's legacy by empowering the next generation of caregivers. So I think that's wonderful. Welcome to both of you. Thank you so much for being with us this evening. So excited to start this conversation. And actually, I was going to start with Jaden, but I think I want to start with Dr. Easter. And the reason why is I want to talk a little bit about Melanin Minded. And then I'll pivot over to you, Jaden. But I'd love for Dr. Easter to share a little bit with our audience and our participants this evening about Melanin Minded, the work that you do there, the focus, and some of the initiatives that you have as a part of Melanin Minded, both the foundation and the LLC.
First, let me thank you for having this platform for us to have this conversation as a family. And Melanin Minded wasn't something I thought about to create. We share more about how this disease fell in our lap, as it falls in a lot of our culturally people in this disease, is because we are now recognizing it as a disease. We call it old timers. We call it senile, right? We call it touched. Right? We never recognized it as something that was really a change in the brain, and it happened to us too. So Melanin Minded wasn't anything I thought about. It was more of how do we help our mother because she had diabetes. It wasn't any disease at all. And the point was she was not managing her diabetes to the point where they were going to amputate her leg. And so we asked the doctor very clear, like, what can we do? And they said, well, she has to get her A1C under control. And so we're looking at our mother at the time she was in her 50s, and we were noticing something was going on her then. But at 54, we were saying to her, like, well, Mom, why are you not managing your A1C? You have a medical background. You know the issues with this. And
Was
so
she
once we
was
said
she a
again,
nurse? Was she a
she
nurse?
wasn't a nurse, so she worked as a CNA, moved herself up RNA in those capacities. But the piece that we were recognizing that she was in that field as we knew it. She took care of us, and then at the same time took care of others. She took care of our grandmother. And so what we recognize is why are you not recognizing your own ailments? That's causing some issues with you. And so we didn't know that she was forgetting or having issues then cognitively. And so when we finally got her to the doctor, he said, well, we can save her leg, but we had to put her legs in cast for about a year. And then we will see what we can do if the ulcer subside. And so they did. They subsided. But they did have to amputate her toes. We were all okay with that because she could still move around. But once we got into the doctor's office and they gave everybody a level set of time, this was 19 years ago now. The reality of it is when she came out of the surgery, she had a smile on her face, but she wasn't speaking. And so we were then asking, like, what's going on with her? And they said it's the anesthesia will wear off. So we wrapped our mom up and took her out, took her home. She still wasn't speaking. The next day she wasn't speaking. Then we knew something else was going on. And I say we, it was me and my two sisters. So we took her back to the doctor and we said, hey, this is not this anesthesia. What's going on? And so as we had the initial discussion, as you shared with Jaden, they said frontal temporal dementia. They only gave us the term dementia at that time. And so we were still asking, well, what pill does she need to take to get better?
Mm.
We were asking the doctor, what do we need to do? And so after he gave us the diagnosis, he then said someone has to care for her. So we're looking at him like, well, we will care for her once we know what we need to do. So he looked at us and said, if you need help or if family can't do it, you need to put her in a nursing home. This is exactly what he said to us. So we left out of that doctor's office not knowing about resources, services, supports. We didn't understand the word dementia, what it was, and what else could we do. And so in that led us on that journey of 6 years doing it all wrong. Milwaukee, Wisconsin is where we were born and raised. The answers are right at the ADRC. That's right there on the corner of Elite in Milwaukee, if you know Milwaukee area, which you would think that that's where information we could have gotten. It could have reached out to us, but it didn't. So when we got the terminology of dementia, I started learning about it because I started working for the Department on Aging. And so I started working for the Department on Aging. That's when I started to learn about all of these resources that were out there. That's what made me so mad because I was like 6 years and we didn't get anything about the Alzheimer's Association, Wisconsin Alzheimer's Institute, or any respiratory care dollars. Nothing was given to us. And so we struggled in trying to care for her throughout that time, which we were doing it all wrong. And we realized she was having certain behaviors. And these behaviors became where she would want to eat all the time. She would say she was hungry 24 hours a day. And so as she wanted to be hungry, we took her back to the doctor and said, hey, she keeps saying she's hungry. And we feed her and she won't stop eating this quantity. And she can't eat that quantity because she has diabetes. He knew that as a doctor. I don't know why we went back to him, but that's all we knew. He said, feed her. We told her we are feeding her, but we can't feed her at that rate, doc. So then he says, well, I'll give her some medication. So he puts her on Haldol. And any nurses or anybody in the medical field understand what Haldol is. It's a high narcotic where she would sit and have drool down her face. We took her off of that. We just dealt with her saying that she was hungry 24 hours a day. What we understood is if he would have given us the guidance to take us where we needed to go, connect us to any type of resources and supports, we would have had a better outcome for her and she would have had a better quality of life because we would have understood. We needed a diagnosis. My mother didn't just have dementia because we thought she had Alzheimer's disease. That's all we heard, dementia and Alzheimer's. And so what my mother actually had, we learned 7 years after that diagnosis that she had frontotemporal dementia. If we were told then what that was and we were educated on it, we would have done better. So Melanin Minded is just that. We focus on those gaps. I realized during that process, we didn't know anything. Then I started realizing, and I started working for the organizations, that it was not reaching our community as they should. And culturally, there was an issue because we had denial. We had denial in our community, where we talked about earlier, which is causing us, is killing us. The disease is rampant, as we talk about the amount of individuals, African Americans, Latinos, hit the hardest. And then the reality of it, the resources is not hitting us. So I focused on the reality of it is how do we reach our community in a way that we educate them, and then the gaps that I found were the youth, they were the diagnosis, the men in providing care as well, and then transportation. And so that's what we focus on in those capacities, and we've been building it up as I started working on my doctorate.
No, thank you so much for that.
Mhm.
I'm going to come back and peel back on each one of those pillars you just
Mhm.
identified, but I'd love to bring Jaden into this conversation
Mhm.
and really get his perspective. Hi, Jaden, how are you?
Hey, I'm good.
Thank you so much for being with us this evening. I am very, very interested in hearing your perspective. So, when Dr. Easter talked about bringing your grandmother home, how old were you when your grandmother, she had her surgery, she came home, the doctor gave this sort of incomplete diagnosis. How old were you?
Uh, Believe it or not, that's how I knew my grandmother. Like since I was born, she always was like that. So
Uh,
I seen like pictures and they showed me videos how my grandmother was before, but from what I knew, that was grandmother. How she, yeah. But
so So how did you support her? I mean, knowing that and knowing, this is grandmother, how did you support her? And what was your role as a caregiver? Because I'm sure everyone in that household sort of had a role. Really interested in how you supported grandmother and how you supported the other adults in the household.
um, I treated her as if it was. I didn't look at it as like playing a role. I was just loving her as a grandmother, and I kind of just I noticed things were kind of off, like repeated questions and a lot of things like that. So I kind of figured something wasn't right, but I didn't really look at it like it's a support system and stuff like that. I just thought we were taking care of grandmother. But as I got older and I seen like my dad and stuff, like he'll be real frustrated and stuff like that. I knew like yeah, I basically try to make him feel better, help him out with whatever he needed. I bring her food, just spend a lot of time with her.
That's awesome. And I'm sure that that was a huge help, not only to your grandmother, but to your dad as well and your aunts. Um, so also curious about how did that So can you give me a time of sort of frame of, you said this is how you knew grandmother from the time you were born until how old were you?
Um, I would say, well, now I'm 22. I would say, well, I actually started helping out around like maybe 8, 9. I don't know how old I was,
Okay.
but
Okay.
I don't
So
I don't really know the time. It's forever.
were you the only child in the household at this time? Were there other children?
No, I have brothers and sisters too. They also helped out. So I'll see what they was doing and stuff like that, and I'll just do the same stuff to help out.
That's awesome. And from a school standpoint, I'm sure you were going to school, you were bound having friends. How did your friends or did school, any of that ever intersect with the role of caregiver with your grandmother? Did you have friends that maybe were in a similar situation or that you had to explain and educate them about the experience and journey that your grandmother was on?
Um, the first friend is crazy. The first friend that told me something about it was 3 days ago, and he told me that his grandmother had it. Other than that, no friend ever brought anything up to me like that before. So, and it did affect school a lot because it was a conversation that like it did wasn't really had. So I just missed a lot of practice, a lot of probably late homework, just a lot of stuff that I'll be doing at home. It'll affect the stuff that I did at school and a lot of the things that I wanted to do, even if that was going to the movies or doing all the extra parties, just little things that my friends did after school that I wanted to attend. I couldn't really attend like they did. And it wasn't nothing I told them. I probably will just make up a lie of why I couldn't come. I just make some up. So yeah, it affected a lot of stuff like that.
Wow. Okay. Well, that was thank you for taking that time to care for your grandmother and making that sacrifice. That's awesome. Was there any particular situation that stands out in your mind that having your grandmother diagnosed under this diagnosis or having this diagnosis that sort of impacted you in your childhood?
Um, it was a lot of embarrassing moments. A lot of embarrassing moments where we'll be in like restaurants or whenever we're out in public, she'll have a lot of public outbursts and stuff like that. But it was a lot of good moments too, when she was real funny. One time I was sweeping the kitchen and I swept over her feet and she just went crazy on me. And my dad had to explain to me why she went crazy on me. And I thought it was because what she was going through, but then I learned like you're not supposed to sweep over nobody's feet. So yeah, it was I got a lot of stories. I can go all day on stories.
Share the story about when I left and she went off on y'all with the belt. Because I didn't understand I shouldn't have left mama home with the kids. Go ahead,
Yeah,
Tim.
she was trying to whoop everybody. So she was trying to whoop everybody when he had left. And I don't know if you came back in time, but we was all hiding. By by the time he came in the house, she had the belt. She was walking around swinging. We was under couches, beds. She wasn't gonna catch us the whole time.
I have to tell you, Jaden, with my dad, I have the most fondest memories because he would make me laugh as well. I have stories too, and this is about you. It's not about sort of my journey, but I can 100% appreciate that because it was such an I miss my dad, but he gives me great joy when I
Yeah.
reminisce and I think about being with him and caring for him and the laughter that he brought me. So I 100% can appreciate that experience 100%. Okay, so Jade, I'm going to come back to you, but I'm going to switch gears with your dad because I'd love to know more about what Dr. Easter is doing. I know that, and I don't, there's two things in particular I'd like to talk a little bit about tonight. I'd love to talk about the transportation project that you're working on. I think that's amazing. And I don't know if it's you or Jaden that I can talk to about with that caregiving curricula for teenagers?
It'd be both of us, yeah. I would add a little bit about what he was saying for people to have those context. We didn't have the education to understand what the disease was, and so we were actually doing it like it was normal aging. And so if we talk about us as a group, we are providing care for our loved one because we see them as our mother, our father, our husband, and wife. We're not recognizing that there's changes that's going on with them, and then they're not the same because the brain is actually seeing the world differently. But we continue to try to have them go through the same process as they used to do. It happens a lot, right? Eyes and ears lie to us all the time. So when I brought up the story about the caregiving component, was my sister provided care for my mom majority of the week. I provided care over the weekends. My other sister got the care also. That's how we worked out our team. When it got to the point where it was too much for my older sister, she left the state. She came back, but she left the state and was like, it was too much. And so a lot of that extra came on with me and my other sister. There was two different households in care. My middle sister, who provided majority of the care, had everybody on board providing care. So my nieces and nephews were providing care. My nephew picked my mom up, changed her, and all of that. My middle nephew rejected it. He said, I don't want to do this. I don't understand. Why do we have to do this? My niece, who was 9, was giving my mother insulin injections at the age of 9. My sister taught her to do that. I mean, I'm at the point where drawing the needle, pinching the skin, all of that was a part of that. So they were teaching these cares that we were giving them, which were PCW cares. In my home, I did something different. I didn't want the kids to do all of that care, so I put it all on myself. Where Jaden saw me in the concept of being frustrated, and I would have them piece in as they could because I wanted them to see them different. There wasn't a right or wrong. We just didn't understand what we were doing. And so there was a lot of times when I said, hey, you all, I got to go to the store. I got to grab something for mom because there was nobody else in that capacity. So I need y'all to stay with her. Not understanding, my mother was still aware of what was going on. But at the same time, she shouldn't have been left alone at that piece without anybody else there in structure. So we laugh about these different components, but it's once we as a community understand how the person is actually based off of the type of dementia they have, we have a better understanding how we care for them. I just wanted to put that too in context in our discussion of why this really came into be Melanin Minded as well, because I realized we were all doing it wrong. And no one's coming to tell us directly on how to do it, whether we were listening or not, it's affecting us as caregivers in this process.
So were you recognizing that no one was there really this gap of not understanding the temporal, was it the physician that
Yes.
didn't
So
communicate?
when the physician gave us the diagnosis of dementia, all we heard just with the disease was dementia and Alzheimer's.
Mm.
We did not know that there were any other types. And as we know, there are over 72 to 100 different types of dementia. That's what I train on now. And we also understand is once we understand the type of dementia the loved one has, we have a better understanding of how to care for them. That's what we didn't have. If we get a proper diagnosis and then they tell us the type, it's more for also the caregiver because we have to make sure we understand. It's like if someone says they have a problem with their arm and everybody keeps touching their leg. They keep treating that, saying, oh, your leg, okay. No, the issue is your arm. And since we can't see the damage, we need the information to be shared with us to understand that each type of dementia that you may have also goes to a certain type of behavior of communication. We need to know that.
Yeah, and then it would have been amazing to have some type of training.
Oh, absolutely.
Given that diagnosis, it would have been lovely if you could have gone and had a hour session
That's
with
correct.
an Alzheimer's specialist or
Yes.
the Alzheimer's Association or one of the great speakers that we've had on this webinar series to kind of explain. And then to your point, that's going to really direct how you provide care to that loved one.
So let me tell you how we found out about she didn't have Alzheimer's disease. It's real quick. Once we started using music, we fell upon music as a way to help her curb her behaviors. And so we would actually get her musical playlist created with us. It would be her Motown and gospel is what we would use. And so she would use that and put it in her ears, and she would have a little bowl of food with her. And that was a part of what the youth would do, sit her down and she would eat. But what would happen is that she would sit there and she wouldn't have any problems. One day she winced. This is why I talk about us being detectives in some of my trainings. She did this. And I looked at her and I went over and I said, Mom, Are you okay? Took the headphones off. And she said, yes, give me to the food, honey. That's a part of the aphasia that would happen with the frontal temporal. We didn't know. And so she said, give me to the food, honey. And I was like, Mama, you okay? And she said, yes. So put the headphones back on her. And I was like, what? And then all of a sudden I was like, well, why come all this time my mama hasn't said she had a headache? She hadn't said she had a backache. She hadn't said she was in pain, nothing. But when the headphones got off, she said she was hungry. Well, we found out my mother was not hungry. She was in pain.
Oh,
She was,
wow.
she was actually communicating because frontal temporal has to do with executive functioning. There's gaps. Alzheimer's, we kept thinking it was memory. It wasn't memory. She knew old and new. What she was doing was she was trying to communicate to us that she was in pain. And the
Mm,
way she was soothing herself was by chewing, because the mouth was the first introduction to the world for all of us as children. And so she was finding her way, even in that, was trying to understand how she made to manage her, and her chewing was that mechanism. I went to a seminar and they told us very clear. They said, we talk about delirium and we talk about pain. They said, try a low dose of Tylenol first. Those are the type of things that should have been given to us and shared with our community. But what we're doing is we're thinking that they're giving us a hard time with their behaviors. They're actually having a hard time. And so
mhm.
when we talk about the education of the disease, we should understand the type of disease with the true diagnosis, and then we should be taught what that disease is. Because frontal temporal dementia, once we understood she had that 7 years later, everything she did made sense.
Right.
And that's the hurt and pain.
Yeah, 100%. Okay, now I want to fast forward a little bit and better understand how that journey has impacted the work that you're doing at Melanin Minded. I know that you're doing some work from a transportation standpoint. I would love to learn more about that and sort of what was the impetus that made you recognize that this is something I need to focus on within my foundation and within my organization.
I appreciate you so much. The gap is that we found out from the DMV that 300 individuals had their licenses revoked or removed, right? I learned as well as once the keys are taken away, there was nothing to replace. But I also recognized it wasn't just the keys that people were having with the individual driving when they shouldn't be, is their dignity was also taken away. Once they got their driver's license, everybody recognized when they got their license at 16, it was their freedom. And we as caregivers didn't know what to do, or even know what to do once we realized our loved ones should not be driving for safety. We see these silver alerts popping up all the time, right? There's an individual. When we found out from the DMV, what they do is they actually make that determination, but the individuals are now left. And so we recognize that the individuals with this disease, mild cognitive impairment, you think of individuals once there's a certain point where they're not able to drive, they think of the person in a later stage of the disease, not at the part where they're still able to function. The issue is they just can't drive because of certain issues of how the brain now recognizes with their eyes and ears and what they're seeing on the road. And so what we recognize in that process is like, okay, well, how do we actually replace that part of it once it's taken away? And so we came up with a navigator transportation program, which focuses on individuals with the early stages, seniors, and people with limited disabilities. And we got them back into the community that they stepped away from. So that was church, barbershops, grocery stores, and we use a rideshare app called My Melanin app. It's the same type of rideshare technology, just like Uber and Lyft. But we recognize is that, okay, well, we use this, we believe that this will give the better person a better quality of life. But that was just a theory. That's just what we thought. So I was born and raised in Milwaukee, Wisconsin. And so in that, I stated, I need somebody to help me with my theory. And so I reached out to some partners as well as the Milwaukee County Department of Health and Human Services. They gave us funding to do this pilot. And so in this pilot, we actually had 160 rides that we did for 3 months. And we had 6 focus groups. But what I realized is when I started talking about Alzheimer's, dementia, and people driving and riding, they was like, that ain't me. I ain't got no problem with my driving, and I can get around. And so we couldn't say that. So we started focusing on the faith-based communities, and I started working with, you all know her. If you don't, you're going to know her, Dr. Faye Epps, that's pushing the faith-based communities to be dementia capable, dementia friendly. And as I started looking at using the faith-based communities, I started having conversations with them to say, hey, you have people that are not coming to church because of transportation, stigma, and all of that. But we're doing this pilot, want to know if some people will be at least interested in trying it. And so we couldn't go to the individual that we may think that they have it. We said, are any caregivers that are providing care for a loved one? People start raising their hand. Well, hey, all we ask you to do is take this rideshare service, give us some data back. You get the ride to go to either a clinic, but also a place that you stepped away from. We couldn't ask them the type of dementia they have. So we use a technique called T-Snow's GEMS to assess their function level. And as we assess their function level, we were able to also assess the caregiver's understanding, caregiver burden, understanding of dementia. What we found out of that, was amazing. We recognized that we had a theory, but we found the theory to be true. So out of those 160 rides, we had individuals increase their quality of life. They were able to step and go back to places they stepped away from, barbershops, grocery stores, as well as the church. The caregivers were able to share with us some of the things that they missed, their gaps, the resources that they didn't even know that was out there. We also had the youth create musical playlists for families because it's not just the ride, it's actually the experience. So the science is that as we play that music for them, that actually stimulates their ride. And it's not a door to door, it's a hand to hand. So the youth created musical playlists for individuals. They took that ride, and what we found out as well is that some of the places they stepped away from is because they felt unsafe. So we were able to do that in Milwaukee, and now we're duplicating that into Texas with the help with UT Southwestern with Dr. Ajar, Dr. Favoron Epps, also with UNT as well, and more organizations that are coming in. And so it allows us to work with the churches because that's where we're getting the drivers. That's where we're getting the riders as well, but they're also getting paid. So there's not anything that they are doing voluntarily. And we found drivers that had the heart. So I can share a lot more, I know, in time, but if anyone is interested, we can have more dialogue because we're doing this right now and we're interested in bringing it to other cities in this process to help bring economic stimulus and workforce development as well.
Should we share your information? I'll ask Catherine to include your information in the chat if anyone is
Yes.
interested in learning more or volunteering. Now,
Yes.
and a question for me is when you have this ride share, is it free of charge or is there a fee? Is it like Uber or?
Yeah, come on now. You gonna have me keep going. I'm gonna keep going with it. So no, so what it is that we have the LLC and the foundation. The foundation allows us to get funding and grants, and we're looking for anyone that's willing to do that because we don't want individuals to take this ride and have to pay the cost because they're diagnosed with this disease. So the pilot allows us to show in each community that there's a need. That's what we had to show. So we
Mhm.
showed that there was a need and people could utilize it. We have funding coming through our foundation. We help cover the cost, but then the LLC allows the drivers to get paid both ways. So the
Ah,
drivers go through our training, 72 hours worth of training they go through. They have more training than EMT sometimes, drivers and taxis, buses, and some Uber and Lyft drivers because we provide that training for them. But what also they can do is they can say, hey, I want to use this app to just pick people up like you and I. They get paid for that ride. So they get paid for the ride they do. We got 80% goes to them, 20% goes back to the LLC. We take a portion of that, put it back into the church. So they're actually using that funding out of us, goes back in the church or organization they're in. And then another portion of that goes into the foundation to cover it. So we continue to have a rotation of funding that's able to help individuals go through. And so we're looking for that to be able to build our community in a capacity that you can actually do good and make a profit at the same time. The riders who take it, just like you and I, are now able to use this technology to say, this my ride is going to help somebody else. So if
mhm.
I go to the airport, a portion of my ride is going to help somebody with this disease in that process, and then also help the driver who's taking it. That's how we're looking to utilize this process.
Okay, that's awesome. Well, I wanna jump back to Jaden, but before I do, and I'm gonna come back to you because I want to ask you a little bit about some the sort of the curriculum you have or certification around the caregiver. I want to come back to that, but I'm gonna skip back to Jaden and then come circle back to you. Jaden, I wanted to circle back with you because your dad said something and it stuck out in my mind. He said that, he sort of had his way of caregiving within his household with your grandmother, and his sister had her way, and the kids would help
Yeah.
her, and he would do it all his own and get stressed out. So when you would visit your aunt and see your grandmother and see your cousins sort of helping out in that regard, was it something that you thought, hey, I can do this too, I can help? or sort of how did that make you feel? Did you feel like I'm kind of happy that my dad kind of takes it all, or that I think this is something I can help with?
It was definitely different on both sides. And that goes back to the question I see somebody asked in the chat. So, basically at my auntie house, it was more like scheduled, like they had different things that they would do. And like, it was, so I have three cousins, and like my dad said, one of them kind of rejected. He didn't really want to do it. So I think that's where the schedule came about, and they made it like a schedule of what they would do at different times. So in different, like at our house, it was different because we kind of did what needed to be done. Like when my dad wasn't there, or when he'll just ask us to do something, we stepped in a lot. A lot of the stuff that they were doing at my auntie house, I actually thought I couldn't do, from taking blood and stuff like that. I was kind of scared to do stuff like that because it just seemed like so grown of a thing to do. And I didn't want to mess up. I feel like it'll be a big mess up. So yeah, they did, we definitely did different things, and it was a lot of things that they did that I didn't want to do. And
Mm-hmm.
some things that it was like, oh, I could do that. Yeah, that's not so bad.
Nice, nice. Okay, I was curious about that because there was clearly that difference, and I agree there were some adult things they were doing, but clearly they managed. So different strokes, different folks. So
Yeah.
um, there's another program I learned about when you were at the Ultra Conference, and you talked about the Bridge Youth Program. Can you tell us all, for not all of us was at that conference, can you talk to us a little bit about the Bridge Youth Program and sort of how that works and how that came about?
So the Bridge Youth Program is a program. It's a real good program. It's a program for youth to come together and learn basically about caregiving. They get to learn about, it comes with hands-on training, dementia one-on-one, a lot of things that we do in the class that will teach them about caregiving, so they can either tell somebody, like other people, or just keep it for themselves and do it in the future. They get paid for it. It takes, I think it's like 2 months, a total of 2 months. We already have went through, I want to say, two of them so far. And yeah, it's just a program to better help you understand the disease. And I think it's, for me, the only place where I could talk to other youth that's going through the same stuff as me. Like, it was no other people like that came to me about it, or when I talked to somebody else about it, they kind of didn't know what I was talking about. But it's a safe place for youth, and we all going through the same stuff. So
Is it a national program? Because I know Dr. Bashir, I know that he's been in, and likely you've been in Texas. You've also been in oh, was it was it Wisconsin?
yes, Wisconsin. So
So
I'll say it's a national program, but
I
so
say,
far
speak
we
it into
only,
existence. Speak that
yeah,
in existence.
I'll say
Speak
it's a
it.
national program, but as of right now, we only did it in Milwaukee, and we're finna do it in Dallas.
and so is it virtual or in person?
We started off in person, but now we're virtual.
Great. That sounds awesome. Okay, great. I'm going to shift the gear a little bit to Dr. Bashir or to Dr. Easter, and this may be the same program. I want to make sure that the program that I just talked about with Jaden, the Bridge Youth
Yeah.
Program, is that also the caregiver certification program, or is that a different
It's the
program?
same thing. So what we did with that is I started my doctorate trying to figure out what is the internal, external experiences of African American youth caring for a loved one. That's how it started. And it started because I was watching, there was a difference with my nieces and nephews and that. And I was like, what's going on with them? I didn't know. So I started that process. And so what I recognized very clear is that no one was talking about African American and Latino youth in America
Mm.
caregiving. All of the data that I was able to pull was from the UK. And they were talking about these youth that were providing care for a loved one. They were called carers. And so as I started looking at it, I was like, well, what's going on with our group? Because I actually see it happening. And what was I was noticing even as I started writing and I was going through some of the classes, some of the instructors said they was child abuse. They said they don't believe you for providing care, and if they do, they shouldn't. And I was like, well, you're basically talking about my family because we doing it. Our family provide care as a whole unit. And what was happening out of the research that what I found when I've actually started to find out the difference in African Americans providing care and Latinos providing care than our Caucasian brothers and sisters is that we also have to deal with this issue of discrimination, racism. We also have to deal with stress that comes from our parents, from the womb out to us. What we recognize is that we carry things differently. The youth do as well. We didn't understand the disease, so how was I going to teach Jaden about what dementia is, and I didn't know what it was? Even though my sister was providing care, taking care of my mother's every day, it wasn't an explanation of what was going on with her with the changes of the brain because we didn't even know she had FTD. So what I recognized as I started doing the research is that our African American youth, what I actually did interviews with, had depression, PTSD, but they also have resiliency in regards to caring for their loved one because they had love. What I also noticed is that these youth were going into careers of civil service because they had that empathy of providing care. What I didn't have understood, as I say, with our recommendations, is there was a culturally appropriate and age appropriate training for these youth to train them. I didn't see that. So instead of me asking what's out there and I started realizing, I started creating it. So that's how I created it. I started calling these youth invisible caregivers. And so I said, well, what we need to do is we need to pay them and we need to train them on the things that they're already doing in our home. My niece, when I said she was giving insulin injections, that's CNA training. That's personal care work training. That's RN training that she was getting at 9.
Yeah.
So we wanted to recognize that and certify them in that process. So I brought in a nurse that was a part of us named Julia Means, as well as Brenda Easter, my cousin. She was a nurse. And so we brought them in. I say, is there some curriculum that we use that you all go through as nurses? They would say, yes, state-led, training. We can do some seeing them go through the process and giving them hours for their training under PCW based off of the state requirements, and we can actually certify them under a certain amount of hours. And it doesn't matter if they are going into it at 18, 19 or any field, as young as they go through it, we can still certify them under their life skills. And I said, let's do it. So I said, well, where are we going to get this money from? So we recognized that there was an organization called Employ Milwaukee that had some funding that they were doing, which is called workforce development training. So we connected to those workforce development organizations and said, we're doing this training with youth that are caring for individuals with Alzheimer's dementia. Do you have any of that training so far in any of your programs? They said no. Well, we were interested in adding yours, and they did. So they actually go through a program called Earn and Learn, and they go every summer. We have up to now 20. We graduated a total of 20, and they go through a total of 48 hours worth of training. And then once they get out of the training, they have gone through Dementia 101, Music and Memory certification. We partner with Educate to do Dementia Live. And then also what they're able to do is understand about the other thing about grief. So we go through the gamut of them in the training. They're in a cohort from starting ages 15 to 25. And so what we're recognizing that they're getting is that they have other peers that are with them, understanding what's going on. They go through this training online and in person. It's both, it's hybrid. And then the other thing they're getting paid. And so once they are a certain age, we work with partners that were with us that had these home health organizations, or they had these facilities, and they allow them to come in and work at their facilities. And if someone that were able to work, they're now helping us build these dementia-friendly communities through the churches. And so the Dementia Village concept, the process is to help build the churches using the youth by doing the music and memory as they're creating the musical playlist for families. And then also they actually do Dementia Live for the churches in them as well, helping them support them as well. And so we're looking to expand. Any organization want to help us in that process, but we see that this is a model that we are actually looking to take to different states. So Milwaukee was where we started it. As Jaden said, we're moving in the Texas area and Atlanta as well. And this group that we finished with is actually going to be going to Atlanta. We'll do the Alter Summit to be able to be on the stage again to talk about what they've done.
That's
Thanks to
awesome.
Dr. Epps.
That's awesome. Well, Pastor Thurman made a comment here, and I'm gonna share that with you. and then I'm going to get back and I'm going to close this out. But before I thank you and Jaden for just sharing, I have more questions, but I ran out of time. But Reverend Thurman wanted me to ask Dr. Easter if you have approached AARP for funding. He's a member of the organization in Kentucky, and he knows that there are grants available through the AARP Nation for such projects. So I wanted to make sure I shared that information from Reverend Thurman. Oh
Thank
no,
you, Reverend. We
it was Reverend. You know what? I'm looking at Pastor Owens, and it was actually Reverend Thurman that made that comment. So I apologize.
Reverend Thurman, yes, we went through AARP to do the navigated transportation. They helped us fund some of that pilot, but we are looking to have these type of support with any organizations that you know of that's willing to come and bring this together so we can bring this to each state. We do these in stages, so we're not looking to do anything just by shotgun. Our goal is to be very strategic in bringing these things in a process. So, but we are ready to have that conversation across the board to help our youth and the individuals that want to be a part of this transportation. And I know we are at that point of time, Tiana, but I want to also thank you so much by seeing this at Altar, by us having this conversation brought us to this point to be here for more people to hear this conversation. And so we have some innovative things that's coming out of our community. They're coming out of our community. And we want people to know that we can do more once people know about what we're doing and we partner together to make it happen. So thank you so much.
Thank you so much, Dr. Bashir and Jaden. I just want to extend my sincere gratitude and thanks to you for sharing such an interesting approach that was based on your journey. That was really an amazing story. You were very healing for me this evening as well, because throughout several moments of our interview, I just remembered when we talked about driving and I had to take my dad keys away, and we talked about the funny moments. So it was really a joy to have both of you here today, and it was really very heartening for me as well to be a part of this interview with you. And I just want to extend extreme gratitude to both of you. Thank you so much for being a part of our webinar series. We greatly appreciate you sharing a very personal topic, but just look at the amazing work that came out of your journey with your grandmother. So thank you for being here with us this evening. And before I let you all go, I just wanted to highlight our speaker for our next webinar, which will be at the end of June. He's Robert Reed. He's amazing. I just recently met him and just love the work that he's doing. He's actually helping us as we identify speakers for our Essence article this year. He's working with us to help us in that direction. And once we started chatting with him, we knew we wanted him to be a part of this discussion as well. So he's actually on our call this evening. We wanted to show him sort of how we have this meeting, and we look forward to seeing him at the end of June on our next webinar series. And I think that's it. Here's our QR codes again. You guys can follow us on LinkedIn and Facebook. You're amazing. I have to give a shout out to our participants and attendees. We are so fortunate and so blessed that they come, that they're here with us every month. We really enjoy their participation. They give us amazing ideas, and we're just grateful for that they're part of this, because we learned tonight from our speaker how important it is to be educated on this topic and the gaps, what happens when we have these gaps. So again, thank you to our participants tonight and to our amazing speakers. And thanks to my team. My team is amazing. They're the reason I'm able to do this every month, and they just make it such a smooth process. So I'm grateful to my team for putting this all together. I have the easy job. They have the hard work. So thank you all so much. And you all have an amazing evening. Thank you for joining us. And I hope that you're here with us next week. I think you're going to really enjoy our discussion each week. Each month it's a joy. So have an amazing evening, and we'll see you here at the end of June. Take good care, everyone, and good night.